So you want to be a psychiatrist? Well, I can tell you one thing, it's not all lying around on couches and sagely stroking long beards. Well, it could be if you wanted to go into a subspeciality like psychoanalysis, but for the most part it's a little bit more prosaic. So, what's the pathway to becoming a psychiatrist? Well, a psychiatrist is a medically qualified doctor who's then specialised in psychological medicine and become a psychiatrist. So for all the children looking at this, one of the things you've got to realise is you've got to get into medical school first before you can become a psychiatrist. And that means working really hard at school and getting some really good A-levels. And we're looking at really 3 or 4 A-levels at grade A and A star and above to have any chance of getting into medical school, because the competition is so tight. So once you get into medical school, you're then looking at 6 years to qualify as a doctor. And it's after that, only after that, that you can then start specialising in psychological medicine and psychiatry. And it's another long slog of exams and training, and it's going to take you about 8 to 12 years to become a fully qualified consultant psychiatrist. Along the way, you'll have become a member of the Royal College of Psychiatrists by passing some exams, and there may be some other exams as well, and lots of on-the-job training. So, what are the qualities that make someone a good psychiatrist or a good potential psychiatrist? Well, firstly, you've got to be a good listener. It's no good going to psychiatry if you don't like listening to other people, don't like talking to people, and are not particularly empathetic or a good listener. So that's a really key point. But secondly, as I've already kind of hinted at, you've got to be reasonably intelligent to get the sort of A-levels to get into medical school. But perhaps more important than that, you've got to be able to work hard in a sustained way for years. Now, other personal qualities that are really useful to have in a psychiatrist are good interpersonal and professional boundaries, because patients at the end of the day are not our friends, they're a professional relationship, and if you're talking to people, listening to them all day, you need to be able to keep hold of that distinction and maintain it in a professional manner. Otherwise problems can ensue. One of the skills of psychiatry is to be able to talk to someone and interview them in a guided and professional manner, but maintain a kind of warmth and empathy and rapport with them. And that skilled interview technique is how we assess a patient and come to an analysis of their problems and difficulties, reach what we call a formulation, a diagnosis, and then a holistic treatment plan. Other qualities a psychiatrist needs is the ability to defer gratification professionally. You're not going to go into psychiatry if you think you're going to be hailed as a hero every day and be showered with thanks and praise and gifts and cards. It's just not like that. It's a much longer term satisfaction you get from helping people over longer periods of time. So if you've one of the people who wants a quick hit of gratification for sorting someone out and getting someone back on the road to health again, you're probably better going off into another branch of medicine, such as general surgery. Now that does bring me to a good point about medicine as a whole. There's a career within medicine for just about every sort of person and personality there is. If you think about it, you've got surgeons, psychiatrists, physicians, pathologists, anaesthetists, gynecologists, obstetricians. There's something for everyone. So don't feel put off going into medicine if you're not quite sure what speciality or type of doctor you want to be. You'll find something you like. I remember I was in medical school going through and thinking, oh, none of this is really for me. I'm not that keen on this stuff. And I got to the final year and I still didn't know whether I really wanted to become a doctor in a hospital or a GP. It didn't really appeal. And then suddenly I had this epiphany one day when we were on the foreign elective, and I was at the back of a airport bus going to the Singapore airport. It was dark, it was late at night, and somehow it just suddenly dawned on me psychiatry was a thing for me, and I never looked back. So within psychiatry there's numerous subspecialities. So the most common thing to do is general adult psychiatry, but then you can do adolescent and child psychiatry. There's forensic psychiatry for people who want to look after mentally ill people who also get involved with the criminal justice system and commit crimes. Then there's eating disorder psychiatry. There's personality disorder psychiatry. There's neuropsychiatry. There's the psychiatry of addiction, so alcoholism and drugs. There's a huge array of psychiatric specialities and subspecialities. And of course, you can become an academic psychiatrist if you want, but become a lecturer and a professor and do lots of research. So I hope that's given you a little bit of a taster about how to become a psychiatrist and the sort of qualities you need as an individual. See you soon.